Hi, my name is Kimberly Faison, and I am here to represent Immunizations for All Children's group. I am here in hopes of getting legislation to pass a bill that will force all children to be immunized, regardless of their religion. The Immunizations for All Children's group believes that parents should not have the right to decide if a child is to be healthy or not healthy, regardless of their religion. At this point in time, parents that have a certain religious belief have the right to opt out of giving their child or children immunizations. And the Immunizations for All Children's group believes that this is a very costly mistake. They believe that all children need to be immunized regardless of their parents' religious beliefs. I am here to ask you legislation to pass a bill that will allow all parents, regardless of religious beliefs, to get their children immunized. Without all children being immunized, the risk of disease spread to other children can impact other children's health. The impact of this health issue is not just the spread among children, but adults and elderly as well. So they are concerned about not just the children's health and their well-being, but the health and well-being of adults and the elderly as well. This issue needs to be addressed because it helps prevent sickness and disease, simply put. And children that are not vaccinated can be denied enrollment into schools and child care facilities. Immunizations can save your family time and money. A child with a vaccine-preventable diseases can be denied attendance at school or a child's child care facility. Some vaccines-preventable diseases can result in prolonged disabilities and can take a financial toll because of lost time at work. Medical bills or long-term disability care. In contrast, getting vaccinated against these diseases is a good investment and usually covered by insurance, and that is a good thing. The Vaccines for Children program is a federally funded program that provides vaccines at no cost to children from low-income families. So it's not like they're going to have to come out their pockets to make sure that their children are healthy. These children will be getting immunizations at no cost to them. They just need to make sure that they get their kids there so that everyone can be healthy and no one is being sick from measles, mumps, or rubella, or whatever the case may be. As far as the budget for this bill, it will allow for lower medical costs overall. Less sick children means low or no medical costs for the state and the patients in the long run. The risk we may face is that parents will probably fight for religious rights. And that is where education for these parents come in. Educating them and helping them to understand the importance to get their children immunized is what this group is about. This group is about helping them to understand that they are not here to deny them their religion. They are here to help them to understand on how to be healthy. Once we can get them to understand and educate them on the importance of immunizations to their children and maybe even themselves, then we can help prevent a future of sick children in our society and provide a future of healthy children in our society. So this group understands what they're up against with this bill. And this bill is very important to our city, our state, and our nation. This bill will help children who have no voice. A lot of these children are babies because babies have to get their immunizations, I think a few weeks after birth. I think 2 to 3 weeks after birth. They have to get immunizations. And these immunizations go up until they get in high school and go to college. Before they go to college, they have to get a hepatitis shot, which is mandatory. They cannot go to college without a hepatitis B immunization, at least here in the state of Florida. They have to have that. The risk that they may face are a lot of risks, and the group understands that as well. So they're ready to fight for what is right for the children. They're ready to get this bill going so that we can have healthy children all over. Making sure that all children are immunized will make a positive impact on the society as a whole, and that's what this group is all about, is making positive impact. And making a positive impact is by making sure that all the children are healthy. Because without these immunizations, these children are not going to be healthy. There's going to be health problems. There's going to be sick children. There's going to be time missed from work, as I mentioned earlier. There's just going to cause a lot of problems within the family structure. As far as the budget for this bill, we're talking about lower costs. So if we pass this bill, there's going to be a little money spent, but we're talking about saving more money in the long run is what we're talking about with this bill. Immunizations can save your child's life. Because of advances in medical science, your child can be protected against more diseases than ever before. Some diseases that once injured or killed thousands of children have been eliminated completely, and others are close to extinction. And that's a big word, extinction. And we all know what that means. That means demise, that is gone for good. Primarily due to safe and effective vaccines. Polio is one example of the great impact that vaccines have had in the United States. Polio was once America's most feared disease, causing death and paralysis across the country. But today, thanks to vaccinations, there are no reports of polio in the United States. And that is because of the immunizations that were given over a period of time that have basically wiped this disease out. And this is what we're trying to get across to you all here in legislation that we want passed for this immunization law to be passed among all parents, regardless of their religious beliefs. Vaccines are very safe and they are effective. Vaccines are only given to children after a long and careful review by scientists, doctors, and healthcare professionals. Vaccines will involve some discomfort and may cause pain, redness, or tenderness at the site of injection, but this is minimal compared to the pain, discomfort, and trauma of the diseases these vaccines prevent. Serious side effects following vaccination, such as severe allergic reactions, are very rare. The disease prevention benefits of getting vaccines are much greater than the possible side effects for almost all children. Immunization protects others you care about. Children in the U.S. still get vaccine-preventable diseases. In fact, we have seen resurgences of measles and whooping cough, pertussis, over the past few years, since 2010, and that's pretty recent. There have been between 10,000 and 50,000 cases of whooping cough each year in the United States, about 10 to 20 babies, many of which were too young to be fully vaccinated, that died each year. While some babies are too young to be protected by vaccination, others may not be able to receive certain vaccinations due to severe allergies, weakened immune systems from conditions like leukemia, and other reasons. To help keep them safe, it is important that you and your children